Good afternoon. How's everybody doing? My name is Krishna Udayakumar. I'm at Duke University and IPIHD. I get the enviable task of being between you and dinner or happy hour, so here we go. All of us as practitioners, as experts, as students of global health, know the extent of the challenge that we face. Let's try. Can we get the slide? Okay. We're going to stay on this slide.
Nod when you want next
All right.
slide.
So we all know the extent of the challenge that we face. There are parts of sub-Saharan Africa where a child born today can expect to live half as long as someone born in Western Europe. Many parts of the world struggle with three core issues. One, access to care is very difficult. Even when there's access, the quality continues to be variable. And of course, the affordability is also a challenge at the same time. And over time, we've come to think of this as this iron triangle of health and healthcare. And what we're trying to do is actually break this iron triangle. And this is certainly not just a challenge in low or middle income countries. We know that we create very little value in the healthcare that we're providing to our own citizens and residents here in the US. And not only that, we know that there are bigger challenges coming. Significant growth in non-communicable diseases, shifting demographics, and rapid aging of populations around the world. Infrastructure that needs to be developed, human capital that doesn't exist. So in the midst of that, I want to actually send an optimistic message today in that all of these challenges are really opportunities. And they're opportunities for all of us as entrepreneurs to think about new models of care, new workforce, new technologies. And I'm optimistic because the solutions are already being formed. Medical Call Home in Mexico runs a call center-based model to provide access 24 hours a day to a doctor or a nurse as a subscription add-on to a telecommunication service. They're providing an affordable way for millions of people to access health services that wouldn't have access otherwise. One Family Health in Rwanda has structured a public-private partnership to empower women nurses to be owners and operators of their own franchised microclinic and provide access to many people to life-saving medications and other medical services. LifeSpring Hospitals in Hyderabad, India runs a chain of facilities that's providing low-cost, high-quality care, leveraging task shifting and using nurse midwives much more than obstetricians. Narayana Hospital in Bangalore is doing US quality and US outcomes bypass surgeries for $3,000 versus $50,000 in the US. So what do all of these things have in common? We wanted to study the critical success factors. First, they get close to their patients and figure out how to embed themselves into their behavior patterns. So if your patients or your customers or your clients use cell phones, let's not expect them to come to our clinics or our hospitals. We've got to use proven technology like telephones more disruptively. We also have to right skill. If we think doctors and nurses are the answer to all of our healthcare problems, we will never train enough doctors and nurses around the world. Fourth, standardizing is good. We know this in the US. Reducing variability in care improves the quality of care. And then finally, stop thinking about healthcare as requiring brick and mortar in clinics and doctors and hospitals. That we've got to figure out how to work in an asset-light model. So if some of these organizations haven't figured out, why aren't they growing? Why aren't they taking over the world? Well, there are significant challenges that are preventing the scale and replications of transformative models like this. First, there's no knowledge and networking. Somebody trying to solve urgent challenges in eye care in Mexico doesn't have access to the solutions from India. There are organizational capacities. These are young and growing organizations. And just like we talk about in Silicon Valley, new startups get to a point where you've got to bring in professional management practices, and this is even harder to access in low and middle income countries than it is in Silicon Valley. Funding is always a challenge, whether it's traditional angel investment, venture capital, private equity, or non-traditional things like impact investing or even philanthropy. There's a lack of efficiency in that marketplace where the right money isn't getting to the right organization at the right time. And then finally, all of the rest of the ecosystem. What's the policy? What's the regulatory construct? What's the scope of practice? So what we're trying to understand is not just what makes these innovations work, but what is it about their innovation ecosystem that's actually facilitating or hindering the scale of these models. And we thought this was so important that we actually created a new nonprofit called the International Partnership for Innovative Healthcare Delivery. What we try to do is study the best models of care from around the world so that we can help to scale and replicate transformative solutions for health challenges globally. We're co-founded by Duke University, McKinsey & Company, and the World Economic Forum. And what we try to do is actually build a community. You've heard this idea of community before, and this is the type of community we're trying to build. We've got a network of almost 50 innovative organizations all over the world that are working across different business models, across different health needs, and building the right solutions for what we need. And on the other side of the table, we've got over 20 different organizations, multinational corporations, some of whom you heard from earlier today, foundations and governments sitting at the table, actually coming together. And so at the end of the day, what we're trying to form is a global knowledge network, and the connections you see there are just the ones that have been made over the last several months through our work. So what we can do by leveraging these global knowledge networks is actually start to show impact. So Sala Una Salud was actually co-founded by two gentlemen who came out of private equity and investment banking, and they were so taken by what they could do in eye care that they learned what they could from the Arvind Eye Care model in India, and now have started a similar low-cost, high-quality eye care system in Mexico. They've now done thousands of cataract surgeries for less than a third of the market price before they came in. We've been able to catalyze funding, almost $2 million now over the last 2 years, to wonderful social entrepreneurs around the world that enables them to grow organizational capacity and continue to scale the impact of their work. We've been able to facilitate partnerships, because the types of things that will allow entrepreneurs and innovators to grow aren't just cash. It's really partnerships with established organizations. And Medtronic is one of our organizations that are supporters that has actually formed a partnership in India with ClickMedix, one of our innovators. And finally, we provide a nurturing ecosystem where young innovators can come in, learn from their peers, learn from others as part of their system, and have a much better chance of actually making it as an organization and achieving real social impact. Not only that, what we are trying to do is make sure that we are studying ourselves in a way that allows us to develop and disseminate knowledge so that others can also do what we're trying to do. So we have things like profiles of all of our innovators to learn about what they're doing. We've written case studies about public-private partnerships and how they've been successful in Rwanda, about how to actually take a model of eye care from a place like India and put it successfully into Mexico. We've written policy white papers around how to actually empower human capital innovation in health, and about what's actually happening in health innovation in China. And finally, as I said, this isn't really just about global health and just about low and middle income countries. So we're actually in the midst of trying to ensure that we're talking about reverse innovation. What can we learn from India and East Africa and other places so that we can continue to reform our own system in places like the US and the UK? In addition to this core work in the knowledge development and dissemination, what we've tried to do is inspire others that are also working in health innovation. One of those is a partnership I want to tell you about with USAID called the Social Entrepreneurship Accelerator at Duke. In this case, we were able to bring the best resources across the breadth of a research university at Duke. We've got IPIHD, the medical school, the health system. We've got the Center for the Advancement of Social Entrepreneurship at the Fuqua School of Business. We've got our public policy school, and all of this is coordinated through our own Duke Global Health Institute. And what we've built in partnership with USAID is an actual global health accelerator. So on an annual basis, we bring in a cohort of new health entrepreneurs, initially now moving to be focused on India and East Africa as the places we're most deep in our work. And as we build this pipeline of global health entrepreneurs, we've put together a 3-year curriculum as an accelerator. This is supporting their work in being able to accelerate the scale of impact. It's supporting capacity development internally. It's helping them to understand funding environments and be more effective to access funding. It's also working on policy and understanding what the levers are to affect policy to create more fertile environments. We're also working in the impact investing space through a partnership with Investor Circle, which is also local. They bring decades of experience in understanding what drives investment into entrepreneurial organizations. And so we're trying to grow the field of impact investing to be more relevant to global health. In addition, what makes this all work is really the passion of our faculty and our students. So there is a lot that a university can bring to actually having impact on the ground. But a core mission of our university is also to develop and disseminate knowledge. So we are studying what we're doing because we actually want to learn what works and what doesn't work in trying to support the scale of impact for social entrepreneurs. And as we learn this, we want to codify it and share it with all of you and many others so that everybody else in global health, outside of global health, can learn from what we've done through our experiences to try to improve their own effectiveness. And of course, at the end of the day, we're really trying to scale social impact. So all of this work has been focused on global health. And what we realized in doing this is that what's really required is an institutional perspective to innovation within organizations that work in the health and healthcare space. Whether you're a small, up-and-coming social entrepreneur in Nairobi, or you're a big health system like Duke University Health System here in North Carolina, having effective mechanisms to source ideas, evaluate them, pilot them, and scale them are what's needed at an organizational level to continue to scale impact. And so making sure that we're not just talking the talk, but walking the walk, we've now created our own Institute for Health Innovation at Duke. This now leverages the breadth of our university as well as our own health system. And we're focused on what we're calling health delivery science. So what are we learning from studying healthcare delivery models and financing and technology from around the world? And how can we embed that back into our own living laboratory at Duke and move that to a national context and a national conversation of how to reform healthcare in the US? We're focused on health technology, really thinking about information technology and informatics as core areas where we think we can have impact in trying to improve health and healthcare. We know that organizations in health are very complex and need to have leaders that are able to understand things like change management and innovation and quantitative health sciences. So we're building educational platforms to ensure that leaders of other health organizations have the skill sets that they need to be effective leaders. And finally, we're really working in applied health policy. So not in a theoretical sense, but taking the learnings of everything that we're doing and making sure that when it makes sense, it's being applied into the policy and regulatory space so that we can also impact a broader ecosystem over time. Now, all of this work really is just at its early stages, and we hope to continue over time to continue to build. But I want to go back to what you've heard from many other speakers before, which is this concept of a community. So at the end of the day, what we need to be successful is a community of entrepreneurs, of practitioners, of academics, of NGOs, of funders, of policymakers. And at the center of that community needs to be the people on the ground doing the work, who are developing the new ideas, who are in the cauldron of innovation, which are the urgent and emerging health needs. And so I want to invite all of you to become part of our community and help us together to actually change the world and make it a healthier place for everyone. Thank you for the opportunity to be here.